The Public Health Research Institute of India was founded by Dr. Purnima Madhivanan and Dr. Karl Krupp. Dr. Purnima Madhivanan first trained as an HIV physician in India during the 90s, and that's when she started to understand the importance of public health research for communities that are often overlooked. While working on her PhD, she wanted to give back to the place where she studied medicine. So in 2007, she and Dr. Karl Krupp founded PHRII to help rural women around Mysore. What started as a project for her dissertation quickly became so much more. The founders saw firsthand how inaccessible healthcare was, especially for groups like sex workers, sexual minorities, and rural families. After that, there was no walking away. They sold everything they had to keep PHRI going with one clear mission: to promote health and well-being for all, making sure no one gets left behind. At PHRII, we conduct research on crucial issues such as cancer, maternal and child health, infectious and chronic illnesses, aging, and environmental health.
Mysore district has 3 million or 30 lakh people, over half of which live in the 150 plus villages in the area. Over the years, we have built relationships with community health workers or ASHAs and government health clinics here. We have helped with care and capacity building in many sectors like antenatal and newborn care, optimizing health for older adults, the COVID pandemic, and women's cancer prevention and screening. With this, we also conduct research to study disease processes and how best to mitigate them. PHRII has over 250 publications.
I have been with PHRI since its inception. We have touched over 20,000 lives with free medical care and health education. To do this, every rupees must be stretched and accounted for. We must be compliant with government regulation to secure funds. We feel a tremendous responsibility to ensure that all our projects are well executed and impactful.
We have doctors, nurses, community counselors, care navigators, and a wonderful administrative department on our team. We also have a mobile clinic, 20 ground staff, and an in-house lab that we run to bring quality healthcare to those in the remotest areas.
One of the most critical battles we are fighting in India today is against cervical cancer. Here, a woman dies every 8 minutes from this disease. Every 8 minutes. That's not just a statistic, that's 80,000 women every year. These are mothers, daughters, and sisters in their prime. Their lives, their stories matter.
To combat cervical cancer, WHO has 3 recommendations: vaccinating 90% of girls aged 9 to 14, screening 70% of eligible women, and treating 90% of those women with abnormal screening results. As of 2023, India has around 30 crores, that is 300 million women who need screening and 6 crore girls who need vaccinations. We are developing models we can implement to address these challenges.
These populations face multiple barriers, like lack of awareness, stigma, lack of support from their communities, and lack of access to good care. PHRI has worked to understand these issues systematically and then use scientific tools to create solutions. For example, we now have a home screening test with a simple Q-tip instead of having women come to the clinic for a pelvic exam-based screening. We've established a cervical cancer specialty center for technical support and as a teaching resource for government and community caregivers. We want mothers to continue playing their crucial roles in their families, and we want children to have a future free from cancer.
By supporting PHRII, you are not just making a donation of your time or money, you are giving the gift of life. You are helping us stand beside the women of India, ensuring that no woman dies needlessly of cancer or other preventable diseases.
Together, we can give hope, help, and a future to the people of India. Join us in saving lives.